New Style Radio.
Now, a survey reveals that Britons seek anti-aging treatments to stay competitive in work or to reward themselves and maintain a youthfulness. So does youthfulness still equate to success in work for many people? And they say that a wedding is normally identify as a key milestone to undergo some kind of treatment. Of course, because you want to look your best on your wedding day, don't you? These pictures have got to last their lifetime, so you want to look your best. Or just having a procedure for a significant birthday, like I did when I was 50.
What did you have done?
I'm not telling you. But anyway, can't you tell I still look youthful?
Well,
so having...
What was that?
Or having it for a significant birthday.
About...
But joining us now on the line now is Dr. Zach Ali, and he's the CEO and founder of the Derma Medical, and Blair French, who's the Vice President of Marketing Intraline. Good morning to you both.
Good morning.
Hello, good morning.
Good morning, hello, hi.
Before you can hear us. Right, so what exactly does this research show about us Brits and having work done?
Well, I think it just shows that people are a little bit more open to kind of improving their looks, in that it innately makes them a little bit more confident on those kind of special occasions, whether it be a birthday, wedding, a milestone in a career.
So is it necessary to... I don't understand why it's necessary to be looking youthful to advance your career.
You know, I don't think it's necessary. I think the important thing is it's a personal choice, and for whatever reason, people choose to do it or not do it. But whatever they choose to do, they should be choosing it for the right reason.
Are we talking about people sort of in the public eye who want to sort of look more youthful because of their job?
I think we're seeing not just people in the public eye, most people day to day. I think that in this day and age, looking good is something important to people. And it does wonders for their confidence, which does wonders for their careers. And to them, that's quite important. And with procedures like this, it's possible to achieve that without having to do anything quite aggressive. So the procedures that we're talking about really are non-surgical procedures, meaning you don't have to go under the knife, you don't have to have an anesthetic or be in hospital for a couple of days. These are things that can be done safely and effectively and look quite natural in a simple outpatient setting.
So what kind of procedures are we talking about then, Zach?
The sort of procedures we're talking about are cosmetic injectables, which, for those of you who don't know, is injecting Botox or dermal fillers to either enhance or add volumization to a structure in the face. That can range from slightly enhancing lips, adding volumization to the cheeks, removing soft lines and wrinkles, or even just creating a little lifting effect. With these kinds of procedures, it just requires a simple injection into the area. Most of the procedures are generally quite safe as well, and quite simple to do. And for many people who recognise that, the uptake has been a lot higher, as you can see with the statistics of the research.
Now, this is for both of you. So why do you think it's becoming more common? I know you say that people just want to feel better, or they just want to do it. But why is it all of a sudden becoming more common? Is it because it's more accessible?
I think one of the things is that it's always been common. I think the question is that people weren't openly talking about it. And I think, with celebrities being a little bit more open about the procedures and what they have done, it sort of brought it into the mainstream, and it's no longer a taboo. So people are much more confident in suggesting or hinting or alluding to that they've had a treatment. It's something that they don't have to shy away from or be ashamed about.
Now, you do get some people who say that they want to do it for their partners. Do you think that's a good thing, or would you say to them, well, if you're going to do anything, you need it to be done because you want it done, not because somebody else wants it done?
Yeah, I think that is the key, is that you have to do the treatment for you and for the right reasons. And you should never do a treatment because you're being pressured into it from your significant other or partner. And I think the key to that is education, and also working with your physician or aesthetic surgeon to ensure that you are doing it for the right reasons. And that's why, Intraline partners with Dr. Zach Ali and Derma Medical to ensure that the proper education is being done, to ensure that the expectation of the patient is proper.
For these, sorry, on that note, for these patients that consider these types of procedures, we do have consultations, which means we sit down and we talk in detail about the procedure, how it works, how long it lasts, how effective it is. We tell them in detail about the product as well. So they are fully informed before they make a choice, giving off really a cooling off period for them to think about it.
Is there anybody who you would actually say no?
I think a lot of the time we...
And what would be the reason?
So we do. I mean, a lot of the time it's not just about saying yes. It's equally as important to say no to the person who doesn't need it. As practitioners who provide this kind of treatment, there's quite a degree of responsibility on our shoulders to make sure things are done safely. People that do come back too frequently, too often, or request procedures that are completely unnecessary are those that we gently turn away, in essence. And it's very important for them to understand why we turn them away. For people that are candidates for treatment, again, we give them the options and let them think about the treatment before going ahead.
Now, I know professionals such as yourselves, Zach and Blair, that you want a tightening up of ethics regarding cosmetic surgery and such, because there's just too many people who are just setting up in a hotel room, in a back room, saying that, you know, you can get this done, you can get Botox, you can get butt fillers and all the rest of it. How does that affect you when you hear these horror stories? Because, you know, you've done things properly, and then you hear about these backroom people who've gone round and injured somebody or even killed somebody, God forbid. How does that affect you?
I think it's very important. That's a good point you've mentioned that. I'm glad you did, because it is something that is a worry. It's a reason we set up the following partnership with Intraline. People that do have these form of treatments are actually going... I mean, you're seeing all the horror stories in the media of things going wrong, work being done quite poorly. Our aim really is to make sure that people that do perform these treatments are well-trained. They know their safety landmarks. They know what they should be injecting, how much they should be using, and the correct product to be using in that area. And I think that knowledge is very important. It's pertinent for people to have that before they start administering these treatments. And not just that, I mean, the complications that you do see, the complications are taught quite poorly. So making sure people are aware of what can go wrong, how to prevent or correct that when it does happen, something we emphasize on.
And just to add to that, you know, the big CCR Expo is happening over the next 2 days, and there's going to be a lot of discussions about branding and marketing and what clinicians and people who are administering these treatments can do to actually be proactive and really promote the fact that there are very, very credible aesthetic surgeons doing these treatments, and you have to make sure you are taking the right approach to, you know, proceeding with them.
Okay, so if one of our listeners at home, now, they're sitting there and thinking that they don't know whether they need some fillers or they want to have an actual facelift or something, tell us top 3 things they should be looking for and looking at when they're thinking about this. So they give you a call, Zach, what are you going to say?
Well, we offer free electronic consultations to anybody who's actually interested in having this kind of treatment. And that involves not only taking a medical history and assessing them in person, but we do have a good look at their appearance and something that bothers them and help guide them towards the right treatment. I think for patients or people considering treatments, it's important to read about the product, it's important to read about the manufacturer, the people that actually do the treatment, so they're fully informed and know what's available before they actually undergo something. And that's something we all offer here, and that's the key ethos, really, to make sure things are done safe and effectively.
And I'm sure that you'd echo that, Blair.
Yeah, I think for me, fundamentally, education. I think you, as the patient, have to do your due diligence as well, and you shouldn't just rely solely on the surgeon that's conducting the treatment or the one that you're discussing to. And I think, you know, reading the product websites, going to the, you know, websites like Dermamedical or Intraline to kind of get information and make sure you're making the right decision. It is a highly personalized decision that you are considering when you're undergoing a treatment, and the most important thing is that you have to be doing it for the right reason, and education is fundamental to that.
And also, Blair, check out the prices, because, you know, if something's going to cost a couple of £100 and somebody says I can do it for 50, alarm bells should be ringing.
Exactly. Price does not mean that it's quality. I think that's you touched on such a good, point in the industry right now is, it's a tough situation because people, they want to think that they can get the same treatment for a discounted price. But in the world of derma fillers, the derma fillers are not all created equal. And I think that's an important thing to note, is that there are varying degrees of quality. And so, cheapest is not always best. And I think that goes across any industry, not just the aesthetic industry.
Where can our listeners go to find out more information on what we've been talking about today?
I think from a consumer standpoint, and if they want to know more information about a particular dermafiller, Interline.com is a great resource, especially our blog, because we take a holistic approach to health. So we have great tips about, outside of, dermafillers or aesthetic treatments. We do things like corporate yoga and promote that, and tips on how you can, stay healthy while traveling. And then I'm sure Zach Ali also.
Absolutely. So
And
for,
Zach, yes?
for people considering a procedure or who don't know what the procedure entails, how it works, how long it will take to kick in, or how long it will last for, or just even some anatomical knowledge with some pictures, dermamodels.co.uk is a good option for people considering these kind of treatments.
Well, what we'll do for both of you, we'll put all that information that you've just given onto our Facebook program page and our Twitter page, so our listeners can get in contact with you if they're thinking about anything.
That's fantastic.
Thank you very much.
Thank you both very much, Dr. Zach Ali and Blair French. Thank you very